Hi, I'm Carissa Fitterer, a member of Group 4 for the Information Worlds project for LIS 510. This part of the presentation focuses on two subgroups for the Information Worlds Healthcare Professionals project, radiologic technologist and health information expert. I conducted one 3-hour observation and 3 interviews. 2 interviews are featured in this portion of the presentation. Who are radiologic technologists? The Bureau of Labor Statistics defines them as healthcare professionals who perform diagnostic imaging examinations, such as X-rays on patients. More specifically, the radiologic technologist I interviewed said, I do 3 different jobs. I'm an X-ray tech, a CAT scan tech, and an MRI tech. The interviewee attended school for 3.5 years and holds an Associates of Applied Science degree. Prerequisites were taken for the first 1.5 years, and then the following 2 years were spent specializing in radiology and included on-the-job training. What is X-ray, CAT scan, and MRI? X-ray is a 2D image that looks at bone. CT is a 360 view of the whole body, and MRI is a magnet force and sound waves good for nerves, muscles, and tendons. CT is better at imaging.
We have sort of a problem here.
The problem lasted 4 hours. A system upgrade wreaked havoc on daily operations. How do you feel when you are prevented from performing your regular duties? Does it put a damper on your day? The solution? Have the system trialed during off hours using actual staff working with IT professionals. When I asked my interviewee, when working with patients, are you aware of common communication breakdowns or information failures you actively avoid? She said, don't say shoot, don't say laser. 1, because people think they'll be shot. 2, because they think they'll be cut in half. An MA is a medical assistant. It is a position that lies in between a receptionist and a nurse. The interviewee highlighted an information failure due to a lack of understanding of imaging. A fix in progress we discussed was a checklist to help the MAs order correctly. For the purposes of this project, Health Information Expert is a professor who teaches courses on health science information at the University of Washington. Our Health Information Expert has 30 years of experience with a PhD in information science. This particular health information expert works on a global scale. For the past 10 years or so, I have worked in the field of global health informatics, predominantly in low-resource settings like Kenya, Tanzania, Peru, Thailand, and Vietnam. I have collaborated on the development of graduate-level health informatics research and training programs with lead universities in those countries. In addition, I have worked with ministries of health on planning and implementing national health information infrastructure and health informatics research and interventions at all levels, local to national.
We have sort of a problem here.
The communication barrier between fields leads to information failures. No one wants to use a system that does not work for them. On the other side, why would an IT professional want to build a system no one will use? The solution? Health information systems design and implementation teams must include health professionals as well as IT specialists. It is critical that there is a basic understanding of the data information flow in advance of systems development implementation, and IT specialists need help from health professionals in understanding these highly complex processes. In other words, cross-training. Interdisciplinary communication is tough. Some solutions for this could be: develop a common language. Change management approaches should be applied scientifically to the design and development and implementation of health informatics intervention because these principles are true the world over. This isn't something that's just happening in the United States, it's happening everywhere.